So hello my healthy folks, how are you all today? Okay, so today we gonna have a live session on the topic of common cold and flu. So today we gonna discuss about what are the major symptoms of these two problems, how can we differentiate these, how can we tangle with the problem, how can we prevent this, and if once we are infected then how we have to deal with it. So first of all, let's know what is common cold and what is flu. Are these both same or are these two different? So in general, the common flu or and the common cold, both these things are two different infectious diseases. Both are the diseases of upper respiratory tract. So we get the similar symptoms all the time, so we get confused that yes, both these are same. But the flu, that is the influenza flu, it is affected or it is caused by influenza virus, while the common cold, in common cold the causative agent may be many different viruses like parainfluenza virus, rhinoviruses, all other viruses that cause the infection, then it's categorized under common cold. Now on the basis of symptoms, how will we differentiate that yes, if we are having common cold or we are having flu? So if your symptoms are abrupt in onset, or all of a sudden you get fever and you feel chills and you get sick, then yes, it indicates that we are suffering from flu. And if there is a gradual illness, that is, first we get fever, then we get runny nose, then we have headache, all these symptoms, if it is gradual in onset, then we say that it's common cold. All the problems of body ache, fever, rashes, and your headache, all these symptoms, they come and they indicate that we are having flu, while the symptoms like runny nose, your postnasal drip, your congestions, your paranasal sinuses congestion, and your cough, all these are the indicative of common cold. So now these both are the common general contagious infectious diseases that have a time duration of at least 1 to 2 weeks, and after that they itself get healed. So for means to decrease the infection or to get yourself medicated with that, for these things we don't need any medications, because as we know that these are viral infections, so antibiotic medicines will not do any work with it. So that's why we don't need any medications for these infections. Only the medications that we take, they give us relief from the symptoms. That is, we take NSAIDs or paracetamol for fever, we take nasal congestions for the cause for the nasal congestion we are having. For headache we take tablets, the painkillers, and for all these allergic symptoms we take antihistaminics. So in general, if there is any course of antibiotic or so, no, we don't take, because all these are viral infections. Now what we have to do? So there are two different scenarios I am going to tell. First, of a baby or a child which is less than 2 years of age, and another who is younger or elders people. So the most important thing we should take warm water. We have plenty of fluid intake. So the general criteria or the general requirement of a body for everyday intake of fluid is at least 8 to 10 glasses of water. So yes, we should take it and meet the need of the water for our body. And if we are taking warm water, the warm fluids, then it will help in releasing the congestion which we'll have in the nose, in the paranasal sinuses, in our neck. Secondly, taking warm bath with warm water. It will also help, because when we take bath, then our body get relaxed. And another thing is that due to the steam of the warm water, our sinuses and our congestion will get relieved. Third thing, that during night time we'll get enhanced or aggravated symptoms due to a reason that WBC get more active in the night time, and due to its fighting with the infection, the all these inflammation markers, that is your fever, your chills, your rashes, on all these things get elevated. That's why in the night time we encounter more or engorged symptoms. So in the night time when you are sleeping, then just take some lozenges or honey that will lubricate your neck and your this upper respiratory tract, so that you will not disturb your sleep by coughing or by congestion. Okay. And next thing is taking a warm water steam, that is with adding a pinch of salt, and by applying the Vicks vapor rub that comes, that is the Vicks vapor rub that we apply. We should never dissolve it in warm water. We should apply it in our nose, your this neck and your chest, and take the steam at least 3 to 4 times a day. And also take this in your consideration, or just remind this thing that whenever you are taking any steam bath or steam shower or something like that with warm things, never ever expose yourself suddenly to a colder temperature, because that will not help you anyway, but it will aggravate the congestion and the mucus production in our body. So whenever you are taking any steam or you are taking any warm bath, just give at least 15 to 20 minutes to your body to get adapted to a cold temperature, and only then go to your fan or AC air. Okay. Unless and until that, please don't expose suddenly your warm body or your warm mouth, nose suddenly to a colder environment. Next, by taking vitamin C. Vitamin C is one of the most component for boosting your immunity. So regular intake of vitamin C in the form of either fruits, that are citrus fruits like orange, your lemon, your amla, all these things, that will help boost your vitamin C levels. And when you are suffering from these all common cold or flu, just take the tablets of vitamin C. That will not only help in your immunity boosting, but it will also get your throat and your respiratory tract clear from the mucus production. Next thing, that you should take herbal tea. जैसा कि पहले के समय में लोग ये भी कहते थे कि तुलसी लेना, नीम लेना, और ये दाल इलायची दाल इलायची सिनेमन वगैरह ये सब लेना अच्छा होता है. So all these things come in the form of tablets nowadays. So people don't know कि yes, all these things are available in our homes and in our kitchen, that will help us fight from these infections that are so regular and so common nowadays. So they prefer taking those tablets. So just include all these spices, your cinnamon and your tulsi pattas and all these things, your long, elaichi, all these things in your regular diet. By taking herbal tea, you can easily make that by adding all these spices in a water and by boiling them, and have it. It will not only give you relief from common cold, your cough and your congestion, your mucus, but it also helps boosting your immunity also. Now also the intake of ginger is also said to be very good for the same. Ginger is it also soothes your throat. So if one is getting enough cough or is suffering from cough due to the sore throat, it will help in relieving that also. So in general, we don't need to take any medications or any cough syrup, because it prolonged your duration of the common cold and flu. So the normal, as I have told you, that the normal duration of these infectious diseases is 1 to 2 weeks, and they get relieved instantly after this. So if you break this chain or this period of the disease by taking any medications or cough or cold, your syrups, then it will lead to yourself, it suppresses the minor symptoms of the disease, So you say or you feel that yes, now I am relieved, but no, once you have stopped taking the medications, then all these symptoms, by adding on or by aggravated form, it will again reappear. So as much as possible you should avoid taking any medications unless and until you are very much suffering from congestion. So for that, along with decongestant drops and the vapors, you should also take your warm saline water steam and as well as gargles. That will also help. If any one of you is having any question regarding all these things, please comment down. Any general query or any general question that you want to ask about this, that common cold and flu, only this topic, please you can comment down. Okay, so during this phase also you should avoid taking heavy meals. Heavy meals mean high in carb and high in fat. Why? Because all these things enhance your mucus production, and the more mucus will be produced, the more congested or more irritable you will be due to your blocked nose and your congested throat. Next, also in the flu you encounter headache. Headache occurs because the sinuses that are present in your nose, they get blocked due to mucus. So other than applying balms or wicks in your head, and by applying oil and taking rest, you can relieve it. Also you can just take you should pinch this area like this. By doing this, what it will help, all these sinuses, they will clear off. By pressing them in this direction, you'll just direct the mucus from here to here, so it will get out of your nose and your sinuses will be cleared. So in that thing you will get you will get your congestion relieved, and you will have better sleep as well as better respiration. During sleep time also your sleep get disturbed due to this congestion or your cough. So during sleep you should always take some lozenges or the honey, as I have told you, that it will soothe your neck, and due to sore throat you will not get affected, or your sleep didn't get affected. Okay, now how can we prevent ourselves from having these diseases, because these are so common and so much contagious. So for prevention, first of all we have to boost our immunity. How could we boost our immunity? By taking proper food, by taking vegetables, green vegetables especially, by taking fruits regularly, by taking the adequate amount of water or the fluid, that is at least 8 to 10 glass of waters per day. Next thing, by regular exercise. You should exercise daily, and for that I have also told previously that the exercise norm that we should follow is for at least 30 minutes per day, and for at least 5 days a week we should do vigorous exercise. And next, what we should maintain a healthy weight, that is we should maintain our BMI in the range of 18 to 24. That is a good BMI. Never let your body weight कभी आपको मीन्स अपना बॉडी वेट ऐसा नहीं करना चाहिए, या आपका जो फैट डिपोजिशन होता है अगर वो ऐसी जगह पे होता है लाइक योर बेली रीजन, योर हिप रीजन, योर breast region or your neck regions, then it very harmful, because it indirectly gives you signals that yes, you are going to be get affected with diabetes, hypertension and your thyroid. All these areas, when these areas get deposited with fat, that it indirectly suggests you that your all these things you will get affected with these in future. Okay, there is a question. Hi ma'am, ESR is 18. Is this because of iron deficiency? No, ESR, that is the erythrocyte sedimentation rate. Most of the time it get affected due to your infections. If you are infected, So in infections, your WBCs are the natural killer cells, or they are the bodyguards of our body. They'll fight infection, they increase in numbers. So due to this also, and all the components of your blood, that are CBC, ESR, your sorry, not CBC, your WBC, your RBC, your platelets, and your hemoglobin, all these are interrelated. So if you are infected, most of the time when you are infected, then your ESR will be increased. In case of iron deficiency, you will have your iron profile deranged and your hemoglobin will be less. Okay. So if your ESR is increased, most of the chances that you may have came in contact with any infectious disease, or may you have been suffered from that in the past 1 to 1.5 months. Okay. How to deal with that? It only indicates that you have been infected. Okay, so like normally, if there is antibodies, if we get infected, then that is antigen for our body, for against which our body prepares antibody, and these antibody increases in our body, and it remains for at least 6 weeks to 10 weeks in our body. So whenever you are going to test your blood, then it's raised. So it just only indicates that yes, you have had an infection past or in previous days. It will get subsides easily with no, you need not to take any medications or need to worry about this. It will automatically get subside when your infection is completely cured, and after that for 6 to 10 weeks it gets normalized. Like your WBC, that are white blood cells, they get increased, no, whenever you are infected, and when you get relieved or you are cured with that infection, after that 6 to 10 weeks, that automatically get normalized. Okay, Simicol, you are welcome. Now apart from yes, we are talking about that how can we deal, or how can we prevent these things from happening to us. So I have told you to have good diet, include green vegetables, fruits, exercise, and maintain good weight, have regular physical exercise, and plenty of water in your diet. Next thing, you should to have boost your immunity, that you can take have done by taking vitamin C regularly. Vitamin C that you can take in the form of fruits, or you can also take tablets for vitamin C. That will help you immune your boosty, and once your immunity is very good, then even though you can come in contact with a person having all these diseases, the chances of you catching the infection and these symptoms overcoming your body, it will be very less. Also just take enough sunlight also. As in the previous live sessions we talked about vitamin D, so also you have to maintain a good amount of, or the normal range of vitamin D in your body. It also helps it also boosts your immunity. And next, you should always take your herbal tea, or all these spices that I have told, your ginger, your cinnamon powder, cloves, and your garlic. You should include all these things, your asphodite, all these things in your diet, because all these help in boosting your immunity, as well as they have anti-inflammatory and antiseptic properties. It will heal and help have good health of all your organs, and it also helps clearing out the waste of your body. So the normal day-to-day problems that we face, having pimples or having constipation, loose motions, not feeling fresh, or all these things, having repeatedly dry mouth, dry skin, oily skin, all these things can be treated by all the spices that are present in your kitchen that you are ignoring till now. So just add these, don't If you have to restrict anything, just restrict the amount of fat, amount of carbs, and the amount of oil and the amount of salt that you are using. Okay, any other question? Also, you should also encourage your child, please don't sit on the TVs or laptops or on the screens only. Just go outside, play. That will help building your bone, your help will in your growth, help in boosting your immunity, all these things. Because if a child is healthy, then only that when he is going to be adult, then he will be a healthy adult. Because your construction or your bodybuilding, that start from the early age also. So also when we start feeding our baby after 6 months, when we start weaning, when we introduce solid food, so then also you have to restrict the salt and sugar amount that you are giving to a child. Okay, for the congestion part, I was going to tell that for congestion part, if a baby is small, means less than 6 months of age or less than 2 years of age, when they cannot blow their nose properly, or when they cannot cough out the sputum from their throat, for that you can easily get a suction that is used commonly for a newborn baby or smaller childs. By that you can easily suck out the sputum and relieve the congestion, because the child cannot tell that yes, I am getting blood. He just get irritated by the problem. So by doing that suction and by removing that thing, you can help them get relieved. What is the cause of bloating? Bloating, there are many causes of bloating. The main causes of bloating include the 4 or 5 main causes. First of all, it's very common symptoms whenever you are in your menstruation phase or you are having your menstruation, then bloating is very common. Secondly, when you are having enough of flatus, or your flatus and your acidity problem, then also you will have bloating. Third thing is your fetus. If you are pregnant, then there are the increased chances of bloating. And then if there is any fluid, and that fluid is not in your stomach but in your peritoneal cavity, so that in that case also there is the chances of bloating. So you have to just rule out that what is the cause and where is the problem. If that we are thinking that yes, it is bloating, but somehow it comes out to be any other problem. So the main reason that we in general condition encounter bloating is the menstrual problem. Second is your flatus. If you are having much of spicy and the fatty meal regularly on the regular basis, and you are having the habit of immediately going to bed or sitting after having any meal, then it will lead to your increased flatus formation as well as acid formation. That will lead to acidity, regurgitation and your bloating. Okay, any other question? Nowadays, as we have transformed, we are going from winter season to summer season, there are most of the chances that we will get these common cold and flu. Why? Because we suddenly just introduce our body to colder environment, but this should not be done. You should just give a transition period to your body. If you are being in a warm region or the warm condition, like if you are nowadays, if you are coming from outside your sunlight, then that is the hot temperature for your body, and you are going to be in a AC room, you will going to have in the colder environment. So you should give transition in between. What it means that when you are coming from outside, then at least give your body 15 to 30 minutes to just accumulate to the normal environment without fan or AC. Only then you should go into the colder region. Okay, because this is the most common reason of being ill in summers. Maximum number of times we sit in the AC rooms or AC office, and suddenly we leave that room and go in the outer environment. So just sudden reflux in the temperature of the body, it leads to your common cold and all these illnesses. Okay, there is also a question, ma'am, immunity disorder is genetic? Yes, it can be genetic. There are many genetic immunity related disorders, but that the percentage of it is very low. You say only 1 to 5% only, or you say less than that also. So you need not to worry about that. For immunity boosting things, you have to just keep in the mind all the things I have told you during the session. That will help boost your immunity, unless and until, yes, as you say that it's genetic. But having these genetic disorders, it's very low chances, or it's very rare. Is anyone been suffering from this in your known Simicor? Okay, anyone have any other question? Okay, also the temperature when we say, or when we have to take a steam bath or the warm water bath, then how will we have a right temperature for our body? Because some people, what they do, they hot water they just pour on and they get bathed with it. It will not help you in having any benefit. In return, it will give many problems in you, because having a regular bath with your warm water, you say there is cold water, there is warm water, and in between there is lukewarm water. And also there are many categories from lukewarm waters. So you don't need to take bath with hot water, because it indirectly in males it have affect your sperm count and your fertility index. In females it will in males, females, both, in children also, it will lead to many of the skin diseases. So please avoid taking bath with hot water. Whenever you are going to take a bath with lukewarm water, how you will check? Just take the water in this region of your skin. If this region of skin, there you can sense the hotness of the water, then this is not good for your bath. Unless and until the temperature of the water in this region of your area is मीन्स आप सह सकते हो, इतना गर्म हो वो कि इस एरिया में आपको वो बहुत ज़्यादा गर्म ना लगे, नॉर्मल लगे, वो पानी आपके लिए ठीक रहेगा नहाने के लिए. सो आप प्लीज़ इस बात का ज़रूर ध्यान रखें, क्योंकि बहुत ज़्यादा गर्म पानी से नहाने से बहुत सारे प्रॉब्लम होते हैं, बेनिफिट आपको कुछ नहीं होगा. Also the same is with drinking warm water. You should never drink warm water, because if when you are regularly drinking warm water, it will get your this respiratory region, no, your throat, your windpipe, sorry, not windpipe, your food pipe, your throat, it will get all these things excoriated. That will further on lead to different diseases, and that will also increase your acidity and regurgitation problem. So never drink hot water. हमेशा हमें गुनगुना पानी पीना है. गुनगुना भी कितना कि मैंने बताया आपको, नहाने के लिए, पीने के लिए, दोनों को ये एरिया से आपको टेस्ट करना है कि पानी आपको पीने लायक है, नहाने लायक है कि नहीं. यहाँ से टेस्ट करके ही हमने बच्चे को भी नहलाना है. बच्चों को ये नहीं कि भाई सर्दी है या थोड़ा सा अभी भी उनके लिए मौसम ठीक है, आप नॉर्मल पानी से नहीं नहला सकते हैं, लेकिन इस एरिया से ही आप कंफर्म करके उतने ही गर्म पानी से बच्चे को भी नहलाना है, ज़्यादा गर्म पानी से नहीं नहलाना है. Okay, now I have told much about the topic today. So can I ask some questions related to this topic? Please, I hope you will going to answer my questions also. Please, one or two of you, please comment yes. Only the things I have discussed or I have told in the live session, I gonna ask the same from you, just to check if you have listened or not. Okay. So first question is that which medications we should take. We should 100% we should take in case of your common cold and flu. If we are suffering from this, which medication we should have to surely take it. कि अगर हमें कॉमन कोल्ड या फ्लू हो रखा है, सर्दी खांसी जुकाम हो रखी है, तो कौन सी ऐसी दवा है जो हमें ज़रूर से ज़रूर लेनी है. जिंजर सिनेमन पाउडर इज़ नॉट मेडिसिन एंड वी शुड नॉट हैव टू टेक पैरासीटामोल. ऐसी कोई ज़रूरी दवा है ही नहीं जो हमें लेनी ही लेनी है. पैरासीटामोल हमें सिर्फ और सिर्फ तब लेनी है जब हमें बुखार है. ठीक है निवेदिता, हमें कोई भी दवा नहीं लेनी है. ठीक है, अनलेस एंड अनटिल हमें बुखार है या बहुत ज़्यादा कंजेशन है. हाँ, ये हमें जिंजर पाउडर, सिनेमन पाउडर और लौंग, तुलसी, नीम, ये सब चीज़ें लेनी है. हाँ जी स्वाति जी, यू आर जस्ट गुड. बिल्कुल सही जवाब दिया आपने. विटामिन सी आप फ्रूट्स में भी ले सकते हो और दवाइयों में भी ले सकते हो. वो आपकी इम्यूनिटी को बूस्ट करेगी. ठीक है, नाउ अनदर क्वेश्चन इज दैट व्हाट इज द नॉर्मल ड्यूरेशन फॉर दिस कॉमन कोल्ड एंड फ्लू. मतलब कितने टाइम में ये अपने आप ठीक हो जाएगा. नहीं, सिट्रिजिन भी हमें ज़रूरी नहीं है लेना. मीन्स मैंने बताया ना आपको, ये सब चीज़ें मीन्स जैसे सिट्रिजिन हो गई, आपकी सर दर्द की कोई पेन किलर हो गई, आपका पैरासीटामोल हो गया, ये सिर्फ आपको तब लेना है जब आपको सिम्टम्स हों इसके. ठीक है, नॉर्मल ड्यूरेशन पीरियड क्या है जितने में हम ठीक हो जाएंगे. ओके, यू कैन से, बट द नॉर्मल ड्यूरेशन जब तक हम परेशान होने की ज़रूरत नहीं है, वो 1 से 2 हफ्ते होती है. 1 से 2 हफ्ते में ये रिजॉल्व हो जाता है अपने आप. ये जो 4 to 5 डेज और 3 to 5 डेज आप लोग बोल रहे हो ना, ये 3 to 5, 4 to 5 डेज इसका मोस्ट इन्फेक्शियस टाइम होता है. मतलब जो शुरू के 5 डेज होते हैं, मतलब जिस दिन आप को प्रॉब्लम शुरू हुई उसके 5 दिन तक आप सबसे ज़्यादा इन्फेक्शियस होगे. मीन्स आप सबको ट्रांसफ़र कर लोगे. शुरू के 5 दिन में बहुत ज़्यादा इन्फेक्शियस रेट, ट्रांसफ़र रेट होगा आपका. सो इन 5 दिनों में आपको प्रिकॉशस रहने की ज़्यादा ज़रूरत है. अपना जो आपने हैंकी यूज़ की, टावल यूज़ किया है, अपना यूटेंसिल्स, ग्लास और थाली वगैरह, प्लेट्स जो यूज़ कर रहे हैं, वो कभी भी शेयर ना करें प्लीज़ शुरू के 4-5 दिन में, क्योंकि इन्फेक्शन रेट बहुत ज़्यादा होता है. तो फैमिली में आप सबको ये इन्फेक्शन बांट दोगे. हाँ जी, 1 to 2 वीक. ओके, 1 to 2 वीक. नाउ ऑल द थिंग्स दैट वी हैव टू डू. हमें ऐसी क्या क्या चीज़ें अपनी डाइट में इंक्लूड करनी चाहिए जिससे हम इन इन्फेक्शंस क्या बाकी भी इन्फेक्शन से बच सकते हैं. कौन सी ऐसी मोस्ट इम्पॉर्टेंट चीज़ें हैं जो हमें रोज़ के रोज़ करनी है अपनी डाइट में, अपनी लाइफस्टाइल में. वेरी गुड. हैविंग फ्रूट्स डेली. हाँ जी, बिल्कुल ठीक. निवेदिता जी ने बिल्कुल ठीक आंसर दिया. और क्या चीज़ें इंक्लूड करनी है. न्यूट्रिशनल डाइट. वेरी गुड, वेरी गुड. RDX, OP, सेमिकॉर, एकदम ठीक बोला आपने. और हाँ जी, फूड और लाइफस्टाइल में भी क्या क्या हमको चीज़ इंक्लूड करनी है. वेरी गुड, वेरी गुड. व्हाट अबाउट फ्लूड. कितना फ्लूड हमें लेना है डेली. रेस्ट. वेरी गुड. ये श्वेता त्रिपाठी जी ने जो एक चीज़ अभी बताई है, रेस्ट, ये मैं भी भूल गई थी आपको बताना, जब भी आपको कॉमन कोल्ड या फ्लू है तो आपको रेस्ट लेना है, ज़रूरी है। जितना ज़्यादा आप रेस्ट लोगे उतना जल्दी आप रिकवर करोगे। थैंक यू ये चीज़ रिमाइंड कराने के लिए। रेस्ट प्लस डेली में भी आपको अपनी प्रॉपर स्लीप लेनी है। ओके, एटलीस्ट 7 to 8 आवर्स की डेली स्लीप बहुत ज़रूरी है। दिन में सोना अच्छी बात नहीं है, आपने दिन में नहीं सोना है। रात की आपकी अनइंटरप्टेड 7 to 8 आवर्स की स्लीप ज़रूरी है। फॉर दैट रीज़न यू हैव टू टेक योर फ्लूइड और योर वाटर, मीन्स आपको पानी अपना 7 से 8 बजे के पहले ही लेना है। यदि आप उसके बाद लेते हैं तो आपको फ्रीक्वेंट यूरिनेशन का दिक्कत होगा, जिसकी वजह से आपका स्लीप डिस्टर्ब हो जाएगा। तो अनइंटरप्टेड आपको 7 to 8 आवर्स की स्लीप नेसेसरी है, रोज़ के रोज़ लेना। ओके, आई थिंक दिस सेशन वॉज वेरी गुड एंड वेरी फ्रूटफुल बिकॉज आप सबने आंसर दिया और आप सबने अच्छे से सुना। थैंक यू सो मच फॉर दैट। होप विल अगेन ज्वाइन इन द नेक्स्ट सेशन। टिल देन जस्ट बी हैप्पी एंड बी हेल्दी, स्टे फिट। थैंक यू सो मच।